So let me start by saying that if you would have asked me at any point in my life if I ever expected to be doing what I'm doing now, the answer would have been an extremely firm no. If you would have asked me back when I was in graduate school, getting my master's in occupational therapy, if I ever wanted to be in A, leadership role, B, to be an entrepreneur, or C, to ever post anything on social media about myself, the answer would have been such a strong no. This is never ever where I thought my life would go. And yet here I am, posting, everything I can think of in the world related to transfer training and caregiver training and safety and my personal life on social media, on the internet. And so one must ask, how did I come to get here? And that's a really good question. So I'll kind of tell you my story. So my name's Amelia. If you have not seen me introduce myself in any other videos before, I'm an occupational therapist. I graduated with my master's degree in occupational therapy in 2010 from Texas Women's University here in Texas. And I love being an occupational therapist. I know that is, pay no attention to that noise, that is just the dog opening the barn door. She can do that. I love being an occupational therapist. I never thought that I would ever step away from being in clinical practice. In fact, the last job that I had before I kind of set out on this journey, I was working in the county hospital. It was the best job I've ever had in my life. I loved it so much. I loved the people that I served. I loved the people that I worked with. There was nothing more fun or interesting or meaningful than getting to go and serve people in that capacity every day. And yet still, despite all of those things, I walked away to pursue this other goal. And okay, so why would I do that? Why would I walk away from my dream job, basically, being in clinical practice almost every day, to creating educational content on the internet? Well, it's not quite that straightforward of a journey, but it started because I realized that in clinical practice, in like a traditional setting, working in a hospital or working in rehab or skilled nursing or home health, and I have worked in all of those places, outpatient, hand clinics, kind of, you name it. If it's an adult setting, I've basically been there. And I loved all of those settings, actually, but I realized that there were certain things that being in a traditional healthcare setting, I just could never adequately address, not because of myself or because of any of the people around me. I work with amazing clinicians from all different professions and fields, but there are just shortcomings in our healthcare system, as I'm sure you know if you live if you live here, that I just couldn't ignore anymore. And so I actually started out going into private practice to try to fill in some of the gaps and the holes in that system to help provide other ways for folks to access care. And that went fine, actually. That went fine. It went okay. Being in business is challenging, but it generally went okay. It probably, if I had continued down that path, it would probably be going really well for me right now. But kind of as part of that process, as part of that journey, what I discovered was that this other problem that I had known about all along, and that was the fact that caregivers, unskilled caregivers, family caregivers, even professional kind of non-medical unskilled caregivers basically had this huge job, this huge role to fill, and not enough resources, not enough training, not enough support to fill that role. And it was something that I had always known about as a therapist because I had done countless family caregiver trainings before discharging someone home from the hospital or rehab or wherever, what have you. And just realizing, even as I was doing those trainings, that it was a monumental task that I was sending people out to do, and trying to equip them with all of the skills they needed in 1 or 2 sessions in a really short amount of time. And the fact was that actually most home caregivers were lucky if they got any training or any time with a therapist or a nurse or anyone really truly before they were sent home to care for their loved ones. And that was, obviously a problem I had realized had always existed. And then when I left the traditional medical community and went out on my own in private practice, I really realized honestly that, again, because of the lack of easily accessible, high quality training available to caregivers, both professional and family caregivers, that it was really the Wild West out there. People kind of just doing whatever they could to do the best that they could, and wanting to do the best that they could, but not having access to the information, the knowledge, the resources, the support that they needed. And so I seeing that was even bigger of an issue than I had realized before, and seeing how things could be different, and then just over time realizing that there was actually a role for me to play in the solution, and being able to see kind of a bigger picture of a solution and how I could put that together. I kind of couldn't ignore that anymore. And so I really pivoted hard away from private practice into an education model, not focused as I had been previously, because I had previously been an educator at Texas Women's University after I graduated, and so I pivoted away from being in clinical practice to really focus on education, but focus on education for non-skilled caregivers, for family caregivers, for home-based and organization-based kind of non-medical caregivers. Because, as I said, there was definitely not enough resources available to these folks who have an incredibly difficult job, but also recognizing the fact that they play an enormous role in supporting our entire healthcare system. If you have a great, well-trained caregiver from any walk of life, they can substantially impact the health outcomes and the quality of life outcomes of the person that they're caring for, because they're the people there, they're in the trenches. Caregivers are the ones who are actually doing this day-to-day work of making sure that someone's needs are met. And when we can equip them with the knowledge and the skills that they need to do that well, when we can empower them with that, then they can make a huge difference in the lives of the people that they're caring for, from a healthcare outcome perspective, from a financial healthcare outcome perspective, and certainly from a quality of life perspective. But then the other part of that too is just recognizing that caregivers have a really hard job, and that they themselves, in doing this incredibly difficult job, are at risk in and of themselves. So again, empowering caregivers with the knowledge and skills that they need to make good decisions, not just for the people that they're caring for, but for themselves, to protect themselves, to keep themselves healthy and happy and supported, because you cannot care for someone else if you are sick or injured or burned out. That's just, maybe you can for a little while, but you can't carry on for very long. So that's where Higher Standards Caregiver Training comes from, basically. It is the organization that I have built, that I am building, that I probably will be building for a long time to come, to provide those really, really high quality, easily accessible skills, training, knowledge, education to these caregivers, to the organizations that employ these caregivers, and to family caregivers and individual caregivers themselves, because they deserve it. They deserve better, because you know, if you go to the Higher Standards website, you'll see it says, because everyone deserves a higher standard, and that's really what it comes down to. It's not just a catchphrase for me. I really genuinely believe everyone deserves a higher standard. And you know, to me, this is not just a business, it's not just an organization, this is literally a mission to improve the standard of knowledge, of training, of support, of resources, of accessibility to all of those things for these caregivers who make the biggest difference in the world. Because I'm only one person. I can really, as a therapist, I can only impact one person at a time in clinical practice. But if I can share the right education and knowledge and skills with the people who are there impacting millions of lives, then that's an opportunity that I can't ignore. So that is me. That's why I do what I do. That's what I do, and that is why Higher Standards Caregiver Training exists. Of course, if you want to check out the programs available there, you can go to www.higherstandardscaregivertraining.com. Be sure to like me, follow me, subscribe to me, all of those things. Make sure that you're looking out for more content as it comes your way. If you heard any weird noises during the course of the video, that was the dog drinking and chewing on her chew toys. I never realized how loud those things were before. Her name is Adora, by the way. She's a very sweet Great Dane, and she'll probably be making a lot more video appearances because apparently she loves being on camera, and she's my buddy here with me all day. So anyway, that's it for now. Look out for more content. Make sure you like, follow, subscribe, and I'll see you soon. Until then, take care.